Have you ever wondered how pharmacists determine the most appropriate way to administer a medication? Today we delve into this intricate process. When it comes to medication, it's not just what you take, but how you take it. The choice of dosage form and route of administration can significantly impact the effectiveness of a treatment. It's a fascinating world that lies at the intersection of chemistry, biology, and medical science. To start with, dosage forms are the physical forms in which we take our medications. The most common ones that may come to mind are tablets and capsules. But the realm of dosage forms extends far beyond these, encompassing solutions, suspensions, creams, ointments, and even more specialized forms like transdermal patches and inhalable aerosols. Each dosage form has unique properties that make it suitable for certain routes of administration. For instance, tablets and capsules are typically designed for oral administration, where they are swallowed and absorbed into the bloodstream via the digestive system. On the other hand, solutions and suspensions can be versatile. They can be taken orally, injected into the bloodstream, or even applied topically to the skin, depending on their formulation. Creams and ointments are generally designed for topical application, where they deliver their therapeutic effect directly to the skin. Then we have dosage forms like transdermal patches and inhalable aerosols. Transdermal patches are stuck onto the skin, allowing the medication to be absorbed directly into the bloodstream, bypassing the digestive system. Inhalable aerosols, as the name suggests, are inhaled into the lungs, providing a fast and effective route for respiratory medications. In essence, the dosage form of a medication is tailored to its intended route of administration, taking into account factors such as the drug's properties, the desired speed of onset, and the target area of treatment. As we see, the dosage form plays a crucial role in determining the route of administration. But how exactly does this process work? Stick around to find out. Predicting the route of administration based on dosage form is not rocket science. It's a thoughtful process guided by a set of principles. So, let's dive into the process, shall we? Firstly, we evaluate the drug's physical and chemical properties. These include the drug's solubility, stability, size, and pH, among others. For instance, if we have a drug that's highly soluble and stable in a liquid form, it might be suitable for oral or intravenous administration. On the other hand, drugs that are unstable or insoluble in water might be better suited for other routes, such as topical or intramuscular administration. Next, we consider the desired speed of action. Some routes allow the drug to act faster than others. Intravenous administration, for example, delivers the drug directly into the bloodstream, resulting in a rapid onset of action. Oral administration, meanwhile, is typically slower because the drug must first pass through the digestive system. So if a quick response is needed, intravenous might be the way to go. But if a slow, sustained release of the drug is desired, oral could be a better choice. The patient's overall condition and preferences are also crucial in this decision-making process. Some routes may not be suitable for patients with certain health conditions. For example, a patient with a compromised immune system may not be able to handle injectable drugs. And let's not forget about patient comfort and convenience. Some people might prefer an oral tablet over an injection, while others might prefer a transdermal patch over a nasal spray. Lastly, we factor in the drug's intended therapeutic effect. If the goal is to treat a local condition, a topical route might be best. But if the aim is to treat a systemic condition, a route that allows the drug to circulate throughout the body might be more appropriate. Each step is important in ensuring that the drug is delivered to the body in the most effective and safe way possible. To better understand this process, let's explore some real-world examples. Consider aspirin, a common pain reliever. The most common dosage form for aspirin is a tablet, intended for oral administration. The reason? It's a simple and non-invasive route that allows for controlled, slow release of the drug into the system. The tablet dissolves in the stomach, the active ingredient is absorbed into the bloodstream, and relief is on the way. Now let's look at insulin, a hormone crucial for people with diabetes. Unlike aspirin, insulin can't be taken orally because stomach acids would destroy it before it could be absorbed. Instead, it's typically delivered through subcutaneous injection. This allows the insulin to be absorbed directly into the bloodstream, bypassing the digestive system entirely. In contrast, nitroglycerin, a medication used for chest pain, is often administered sublingually or under the tongue. This route allows the medication to be rapidly absorbed into the bloodstream through the mucosal membrane, providing quick relief. Another example is the influenza vaccine. It's available in two main dosage forms, injectable and nasal spray. The injectable form is administered intramuscularly, typically in the upper arm. This method allows the vaccine to stimulate an immune response without causing the flu. The nasal spray, on the other hand, is administered through the nostrils. This mimics the natural route of infection and stimulates a broad immune response. Finally, let's look at chemotherapy for cancer treatment. These powerful drugs need to be delivered directly to the bloodstream to work effectively. Therefore, they're often administered intravenously. This allows the medication to reach the cancer cells more quickly and efficiently. These examples demonstrate the practical application of the process we've discussed. But what happens when there are exceptions? In the world of pharmacology, there are always exceptions to the rule. Let's examine some of these special cases. First, let's look at situations where the typical route of administration may not be feasible or ideal. Imagine a patient who is unable to swallow due to a medical condition or age. In such cases, the usual oral route is not an option. So what do? Pharmacists may opt for alternative routes like sublingual, where the medication is placed under the tongue, or transdermal, where a patch is applied to the skin. These routes bypass the swallowing process, making medication administration possible. Next, consider emergency situations. When every second counts, the speed of drug action is critical. Oral administration won't cut it here because it takes time for the drug to be absorbed into the bloodstream. Instead, intravenous or intramuscular routes are typically used. These routes allow for immediate drug absorption, providing the rapid action needed in emergencies. Now let's talk about prolonged or controlled release of drugs. Some conditions require steady drug levels over extended periods. For instance, chronic conditions like hypertension or diabetes. Here, the aim is not just to get the drug into the body quickly, but to maintain a specific drug concentration over time. This is where dosage forms like extended-release tablets or patches come into play. They slowly release the drug, maintaining a steady state in the patient's body. Finally, let's not forget that patient preference and lifestyle also play a role. Some patients may prefer a once-a-day pill, while others may be more comfortable with a weekly patch. The choice of route can greatly impact patient adherence to medication, so it's something that definitely needs to be considered. As you can see, predicting the route of administration is a complex process that requires a deep understanding of both the drug and the patient's needs. As we come to the end of our journey, let's summarize what we've learned today. We embarked on this exploration with the intention of understanding how to predict the route of administration based on the dosage form. And indeed, we've come a long way. We started by delving into the intricacies of dosage forms and administration routes. We came to understand that the nature of the dosage form and its specific characteristics play a pivotal role in determining the most appropriate route for administration. From tablets, capsules, injections, to transdermal patches, each dosage form has its unique attributes that make it suitable for a particular administration route. Then, we decoded the process. We discovered that it's not just a random choice, but a systematic process that considers the drug's properties, the dosage form, and the patient's condition. We learned that factors such as the drug's solubility, stability, and the required speed of action can greatly influence the choice of administration route. We also examined real-world examples to reinforce our understanding. We saw how a fast-acting relief from pain could be achieved through injections, while a slow, steady release of medication for chronic conditions might be best served through an oral or transdermal route. And finally, we took into account the exceptions and special considerations. We discussed how certain situations might call for a different route, like in cases of emergency or when the patient's physical condition does not allow for the standard route. In essence, the process of predicting the route of administration based on dosage form is a delicate balance of science, patient care, and practicality. It's an art in its own right, a dance between the drug's properties, the dosage form, and the patient's needs. Remember, the goal is to ensure the safest and most effective delivery of medication to the patient. Thanks for joining us. Don't forget to subscribe for more enlightening content.